Mr. Lam Chen-sing. Thank you, Madam Deputy. First, I must thank Ms. Chang Hoi-yan for sponsoring the motion. To tackle our aging population, there will be growing demand for healthcare services. This is made more significant. We face an aging policy with more chronic illnesses. The pressure on public healthcare system is increasing. Now, if we continue to be treatment-oriented, then I'm sure our healthcare system will burst sooner or later. Now, we should place emphasis on prevention, healthy lifestyle, and management of chronic diseases. I think if we have a whole range of community care services, we can alleviate the burden on our public hospitals. We need different organizations in the community, including public and private healthcare organizations, to work together to relieve the burden of our public hospitals. I suggest we have a children health care voucher scheme. All who are under 12 should be given $2,000 worth of health care voucher. Spending medical expenses for children is a heavy burden on parents. By introducing children's healthcare voucher, we can alleviate the pressure on our public healthcare system, and minor illnesses can be treated in private clinics, and so we can lessen the burden on our public healthcare system. I also suggest that the government should include Chinese medicine in our primary healthcare system. We should leverage on the advantage of Western medicine. They're very good for prevention of illness and in the management of chronic diseases. For a long time, Chinese medicine is excluded from our public healthcare system. This has deprived our population from enjoying quality healthcare services. Now, we're going to have the first Chinese medicine hospital in Changquanou. At long last, we are addressing the long-standing needs of the community. Now, for the civil service, they have got joint medical and dental services committee. Now, at long last, they're able to include Chinese medicine for civil service. I think we should enhance our regular funding for the Research and Development Center of Chinese Medicine. We should provide more funding for training of Chinese medical practitioners. We should set up a pay scale for Chinese medicine practitioners to attract new blood to the sector. Now, acupuncture and also massage are related to Chinese medicine, and we should promote these sectors. Now, the sector is saying that they can only be registered under massage parlor ordinance, and very often they are mistaken as vice establishments, whereas in the mainland, many hospitals have got a special department for acupuncture and massage, and I think we should set up a similar specialty in Hong Kong. And we should review the professional development of this sector, including manpower training, qualification, recognition, and monitoring system, so that this can play a part in our primary healthcare system. Thank you. Mr. Edmund Wong. Madam Deputy and Secretary for Food and Health, primary health care should focus more on prevention. And I think we should consolidate resources from the public and private sector and all different sectors so that we can have DHCs and then set up a primary healthcare network in the community. I support this move, but we cannot just rely on the DHCs to satisfy the various medical needs of the community. And so the administration can consider cooperating with different stakeholders so that we can have more comprehensive primary healthcare network with a focus on prevention. Now, we can cooperate with self-help groups of patients. They have relevant services and also training facilities and manpower. If we give them sufficient training and financial support, these NGOs can form part of our healthcare primary system. And I think this is a way to improve primary healthcare. According to statistics, for patient self-help groups in Hong Kong, number over 200, covering all sorts of rare and common chronic diseases. These patient self-help groups are established by patients and also ex-patients and their family members with healthcare personnel as their consultants, providing various support services to patients in need. The SAR government consider these patient self-help groups as social welfare organizations. The SWD provides support funding in forms of funding to over 95 such groups. Now, if the government can change its mindset, instead of considering them social welfare organizations, they can become part of our healthcare system. I'm sure that can benefit the community well. Now, the patients and the patients of these self-help groups, in particular, those of chronic and rare diseases, have fought these diseases for a long time. They have more understanding of these diseases. They have good knowledge and experience of the psychology and also the feelings of patients concerned. And I'm sure they may even do a better job than regular healthcare manpower, personnel. Now, if we can give them some financial support and professional training, they can then provide primary care and advice to patients. So instead of recipients of services, they can be carers. They can provide simple advice and health information and points to note in taking care of patients. That can be very useful. Now, after receiving some training, now because they have suffered from these diseases in the past, they can give patients first-hand information and experience, and they can make up for the shortfall in our healthcare personnel, and they can cover the gaps in the system so that the support can even be more appropriate. I think this will help both the carers and ex-patients and patients to have good primary health care. We must look into the individual needs of patients, and we cannot just rely on public health care system to do it. The government should mobilize resources in the community, and therefore I hope that the administration can effectively mobilize existing resources to improve primary health care. With these remarks, I support the original motion and Mr. Edward Leung's amendment. Thank you. Mr. Tony C. Thank you, Madam Deputy. Now, the standards of hospitals and healthcare are among the best in the world. However, we are short of personnel and beds. As a result, the waiting time is very long for services in public hospitals in particular. With our population aging, I'm sure the problem will aggravate. But if we can improve primary health care, we can prevent minor diseases from developing into major diseases. We should educate the public in how to remain healthy, and we can substantially reduce the need for hospital care. So the fewer people will need to be admitted in the hospitals, and those who really need these services can then be treated and admitted earlier. This is the direction of the countries. Even before the outbreak of COVID-19, presidency already proposed the idea of healthy China. Now, when its people are healthy, then the country will be strong. Well, if our people are not healthy, then we cannot have a prosperous society. So we should provide a full range of and comprehensive and all the time healthcare services. And the main theme is prevention. Prevention is the most economical and effective way so that minor illnesses will not become serious diseases. And there should be good use of technology to promote innovation, and Chinese medicine should be used for prevention, and there should be incorporation of Western and Chinese medicine through promotion of sports and healthy lifestyle. People can be healthy, and it's also good for disease control. I think this is very relevant to Ms. Chen Hoi-yan's motion as well as the amendments by members. As the representative from the serving, architecturing and planning sector, I'd like to talk about the importance of green building to health. We have over 67% of our land zoned as country parks or green belt. However, we are severely short of land for housing. For a long time, the government has overlooked the need of healthy living space. People are living in a very substandard conditions such as subdivided units. So people feel that the government attaches more significance to quantity than quality of living conditions. So with COVID-19, we get to appreciate the adverse impact of poor and unhygienic living conditions on health. About 10 years ago, in 2012, when I was a legislator, I already asked the administration to set up indicators of living space per capita so that we can all have more spacious homes and better homes. I said that near residential dwellings, there must be certain green space and green belt to encourage walking, and we can encourage living in space in place, and that the old and young can live together, so that people will be healthier and there will be less need for hospitalization and medical treatment. The government did not follow up on my suggestion. It even queried whether it was a luxury. As a result, we now have nano flats and also poor living conditions, and that has taken toll on people's health. Towards the end of the end of term of this government, at long last, the government understands this importance and has accepted the suggestion from my sector, and there will be low carbon policy introduced in Lantau tomorrow vision. And all right, there is finally this policy, but we need speedy implementation. We must streamline the planning procedures so that more expeditiously Hong Kong can be turned into a green, healthy, and livable city. Thank you.
Mr. Scott Leung. Thank you, Madam Deputy. I support the original motion moved by Ms. Rebecca Chan, that is the 10-year plan for primary health care. I thank Ms. Chan and other members who moved amendments, urging the government to enhance the primary health care system and encourage the people to manage their health so as to prevent diseases. In year 2018, the government it was said that the Hong Kong's primary healthcare system is lagging behind 30 years. The government doesn't have a comprehensive plan to develop a primary healthcare system. For example, the elderly healthcare system, it is to provide a financial incentive under the money follow the patient's principle so that elderly people can choose private primary healthcare services which most suits their needs. Based on the principle of quality primary health care, the government intended to encourage elderly people to make full use of the private medical healthcare system. In the end, the elderly people only use the healthcare vouchers to buy spectacles and even Chinese dry seafood. It's essentially like the consumption vouchers. It is really going against the intention of the government. We have to consider the habits of how elderly people use healthcare vouchers. because of moderately good health and the financial stress many elderly people are facing. They want to save up the healthcare vouchers. Some elderly people prefer to use the healthcare vouchers to buy health supplements rather than using primary healthcare services or have checkups, because they don't think checkups are important. And also the quota is very limited. You have to register to become a member before you can get a checkup. And the price is much more expensive than primary healthcare in the public sector. So elderly people would choose the public healthcare system instead and spend the healthcare vouchers on health supplements. Besides the habits, there is no restriction on use to confine the usage on primary healthcare services, and there is also a lack of education and publicity. In the end, people's perspective or mindset did not change. The intention was to improve the usage of primary healthcare system. However, many elderly people did not spend the healthcare vouchers correctly. The government should consider several points. First, more regulations on the charge of private sector. Some institutions are charging a much more expensive fee than ordinarily, and also sharing of healthcare vouchers between couples. It would enhance the flexibility of the vouchers. And also we should increase the quota for the services and nurture a habit of using primary healthcare service in the private sector. And also we have to focus on the healthcare and dental care program for children. We have to nurture awareness since a young age. And also we should encourage parents to pay attention to warning signs of health problems. We have to expand the publicity of the DHC for different age groups. We have to increase the quota numbers, and also we have to provide a regular dental and eye check for elderly people regularly, free of charge. From the example of the healthcare voucher, it shows that we have to have thorough planning, and we have to make resources and manpower work together to achieve the goal. We have to educate the principle of prevention among the public. We have to turn the mindset around. And also we have to review the basic direction of our healthcare system. President, I support the original motion moved by Ms. Rebecca Chan, 10-year plan for primary health care. We urge the government to spend our precious resources wisely. Thank you. Mr. Holden-Chow. Thank you, President. First of all, I thank Ms. Rebecca Chan for moving this motion. I support her motion. In terms of primary health care, actually, the government is implementing the prevention-focused principle by rolling out the district health centers in all 18 districts. Well, we hope we can have these centers sooner. The ones in Yuen-Long and Tuen Mun will commence operation within this year. Of course, residents want to have these DHCs as soon as possible. Last year, at this platform, I submitted a written question concerning the operation of DHCs. Well, I would like to I wonder, because the DHCs are prevention-focused, can we have more screening services from DHCs for particular diseases? For example, cervical cancer, colon cancer, breast cancer. For these diseases, the government has a central system to receive application for screening. From the perspective of our constituents, well, if we can have these services at district health centers, then it would be much more convenient for the residents, especially the elderly people. If screening services are available at DHCs, it would be much more convenient for the users. On primary health care, as pointed out by Ms. Rebecca Chen, the waiting time for public hospital service is too long, and hospitals are inundated. We have to alleviate the pressure and shorten the waiting time. At New Territories and Northwest, we don't have any private hospitals. In our district, for those living in Tuen Mun or Yuen Long, if the governments can set aside sites to build private hospitals, the pressure faced by public hospitals can be alleviated. Those who can afford private services can go to private hospitals instead, and that would shorten the queue of public hospitals. I would like to encourage the Bureau to study the feasibility of setting aside land in Yuen Long and Tuen Mun for private hospitals. And in the original motion, Ms. Rebecca Chan mentioned the triage service or triage system for the winter surge. Well, when it is the winter surge season, we have a lot of influenza patients, and they would receive standard treatment. If we have triage centers, then the waiting time can be, the slots can be freed up for other patients. And other members mentioned about the elderly healthcare vouchers. To make sure the voucher serves its purpose, I suggest allowing elderly people to spend the elderly vouchers on devices, for example, hearing aids. This is something that many elderly people need, which is not covered by the healthcare vouchers. Like Mr. Scott LEUNG said, people spend the voucher on purpose not intended by the government. So you should encourage them to spend vouchers on medical devices like hearing aids. It would be more helpful, I so submit. Ms. Chen Yutming. Thank you, President. Concerning the original motion moved by Ms. Rebecca Chan, the 10-year plan for primary health care, as well as the amendments moved by other members to alleviate the abnormal pressure faced by the healthcare system and alleviate the harm on patients. Well, the pressure has long exceeded the critical threshold. The waiting time for follow-up, the waiting time for ANED cases, not to mention waiting time for major operations, they are excruciatingly long that it makes people furious. We have a huge shortage of medical healthcare staff because of the exodus in the past 2 years. The situation has got worse. That is the reality. Members have a consensus that the government should implement a 10-year plan for primary health care to address the aging population, as well as enhancing the collaboration between the public and the private sector, and adopt a prevention-focused principle to alleviate the huge pressure faced by our public healthcare system. A framework should be set up. I agree with most of the suggestions, and I think that they are feasible. Mr. Kingsley Wong, Mr. Edward Leung, and Miss Judy Chan and Miss Ines Yong mentioned Chinese medicine. In Hong Kong, most people are Chinese. Elderly people are heavy users of Chinese medicine. However, the government is not paying enough attention to the development of Chinese medicine. It doesn't mean that Chinese medicine is inferior. Many friends told me that Chinese medicine is more suitable to them in terms of rehabilitation and healthcare. The Baptist University, Polytechnic University, and the Hong Kong University and the Chinese University have put much effort in Chinese medicine research. We should take a broader vision. Our country is making huge efforts to promote Chinese medicine. If we can get the support of the Chinese medicine system in the mainland, I think it would be a blessing to Hong Kong people. I support fully incorporating Chinese medicine services into our public healthcare system and fully develop Western Chinese medicine collaboration. Mr. Tommy Cheung mentioned that we should speed up introducing overseas trained doctors and medical staff. I support it. We have to do it as soon as possible. The epidemic is drawing resources away, and we all know the consequences for the patients. Besides refilling our talent pool, we have to improve our hardwares, including setting up more hospitals in the district and more GOPC. Mr. Duncan Chiu mentioned utilizing technology to solve the possible obstacles. I think this is the right way to go. We should develop quickly telemedicine in our private and public healthcare system to facilitate a consultation for doctors and patients. In terms of healthcare vouchers for screening, I have no objection. I also suggest the government providing a yearly checkup and a biannually checkup for those above the age of 60 and 70. These checkups can be performed with the help of contractors. There should also be a triage arrangement. If the motion is subject to the passage of the motion, I hope that the governments would tell us promptly how the governments would provide the relevant financial resources to realize the plan. I support the original motion and the amendments. Thank you.
Mr. Charles Siu-chung. President, for a long time, waiting has been the theme for public healthcare services. Accident and emergency was always full. It takes several hours to get treatment. And then there is a wait of several years for specialist service. So for those who need to seek treatment are already anxious because they have a disease, but then if the wait is so long, so that puts more stress on them. Now, we don't want the public to suffer from this kind of stress. So increasing manpower is the one step that needs to be taken. As mentioned in the policy address, the government has been adopting multi-pronged measures to increase manpower. For example, that's been increased in the number of local training places in institutions, and also there's the importation of non-locally trained medical personnel. So it seems that the government does want to increase manpower in order to improve the current situation. Now, there is a serious shortage of doctors, according to the government projection. We have just 2 doctors per 1,000 population. The Food and Health Bureau has conducted the 2020 manpower projection. We know that by there will be a shortage of 1,600 and over 1,900 doctors in the next decade or so. Now, of course, we have a serious shortage of doctors. Over the years, allied health professions such as ward assistant, patient assistant, operation assistants, there is also a serious shortage. So there is immense pressure in these areas as well. Now, as the government tries to boost the supply of healthcare professionals, there must also be improvement of the condition of service and working condition of other supporting healthcare workers. So more young people will be attracted to join these professions. Now, the hospital authority has proposed in extending the retirement age to 65. There are also other proposals to retain staff. For example, the calculation of annual leave and so on has been changed. Still, we learned that not many people are staying on till the retirement age. So I would suggest that the government should keep the existing terms of service for all existing staff, and then keep them these conditions during the transition, so people will stay on and we're able to retain the talents. The hospital authority needs to review its outsourcing policy. It shouldn't just go for the lowest bid, because then we see contractors exploiting workers. I am all for more proactive measures to boost our manpower supply and address the manpower shortage in the public sector. We want the public to enjoy better quality of healthcare services, so I speak. Mr. Chen Hock-Fung. Thank you, President. Well, we should seek early treatment always. And with healthcare policy, it should be forward-looking. We want to go for prevention rather than cure, but it seems that now the focus is on cure. I support Ms. Chen Hoi-yan's motion. We need to formulate a 10-year plan for primary health care, and it should be prevention-focused. So for each age group, the government should consider the diseases that may occur and then provide screening programs. Now, there is a screening program, Colorectal cancer screening program is a successful program. It encourages the public to get screening in the private sector. So it's definitely prevention rather than cure, and that's the focus. Now, Hong Kong faces various health risks. For example, for women, breast cancer has been the top killer cancer for women since 1994. And then between 1993 and 2019, there's an increase of threefold of diagnosed breast cancer cases, from 1,000 plus cases to over 4,700 cases. So that means, and so this is a serious problem for women. And then last September, the government started the breast cancer screening pilot program that will last for 2 years. We hope this will become a standing program. The best thing, of course, is for the government to turn that into to include it in the standard screening list, so that's a timetable, and so people will be able to prevent the disease. In 2021, there's some primary healthcare directory that helps the public to find doctors, but then the directory only covers registered medical practitioners, dentists, and Chinese medicine practitioners. But for the standing screening program that I've suggested, it will rely very heavily on private practitioners. Now, dentists and Chinese medicine practitioners, of course, play an important role in primary health care service. Now, I think at the moment we hardly have any dental services under primary health care. The government only provides tooth extraction service to the public. There are no other forms of dental services provided. People have to go to a private doctor and pay for other dental services. Now, some NGOs have been providing limited dental services for the elderly, but the application process is cumbersome. I visited many elderly centers. I see that many elderly people have teeth problems, but because denture is expensive, so many elderly people would rather consume liquid or soft food instead of getting their teeth fixed. So their quality of living has been affected. I think dental services should be covered by the government. There should be oral dental scaling and other dental services for the elderly. Chinese medicine has all not been incorporated into the public healthcare system. Since March 2020, the government set up 2 Chinese medicine clinics. But in the review report published last October, the government confirms that this scheme is very popular, so it plans to provide more places. And then at the same time, it's not increasing the number of Chinese medicine clinics. So it seems the government is not too enthusiastic in promoting Chinese medicine services. Now, it's difficult for the government to expand outpatient services or hospital service. For eligible patients, there's now a program to provide Chinese medicine services in hospitals. So far, only 8 hospitals are in the scheme. I hope the government will soon confirm the role of Chinese medicine in the public healthcare system. In elderly care centers, there should be Chinese medicine service that's affordable to the public. Now, for primary healthcare, concepts never been implemented successfully in Hong Kong because there is not a comprehensive plan. Also because there is not a comprehensive plan for investing resources and providing supporting measures. So I hope in the next 10 years we'll be able to implement primary healthcare in Hong Kong. Thank you. Dr. Priscilla Leung. Thank you, President. Primary healthcare is a very important livelihood issue. Dr. Carl Leung always joked with me, but at the same time he's serious too. He said that when someone retires, 50% of his savings will be spent on healthcare services. That's why since I became a member in 2008, every year I asked the government to set aside $10 billion as a form of long-term saving for 10 years. And finally, in 2016, the government agreed to set aside $200 billion for the development of hospitals, say increasing major large-scale accident and emergency wards, building 3 other hospitals, providing another 5,000 beds and 90 operating theaters and so on. But these are all just hardware. We don't have enough manpower, and there's also a high wastage rate. So these are the real problems in the public healthcare system. Now, in recent years, because of political differences, we also see that certain healthcare workers are not being too professional. But apart from that, we should really salute all working in the public healthcare sector. I have schoolmates who've worked in public healthcare system for decades. They forego huge income just because they want to serve the public, so they deserve our respect. But, around the world, there are too many opportunities, and that's why it's important that we support those working in the public healthcare center. But of course, because public healthcare services are good and cheap, so the queues become increasingly long for such services. Now, my friend two friends told me that they went to a public hospital for lung screening. It only cost $80. And another person who's not really that old, he stayed in hospital. It only cost him a few $100s. So you can imagine, therefore, there will be an increasing demand for public health care services. Now, in the future, we're going to spend another $100 billion. We should spend another $100 billion on improving our software, the working condition, and so on for our healthcare staff. Now, we have an aging population. By 2034, 30% of the population will be aged above 65. And now we have 2.8 million people, 2.28 million people like that. And of course, these people don't want to become a burden of society, but really it's not for them to decide, because many middle class become, the low class eventually. Because after 60, the insurance premiums will go up several votes, and so they have no choice but to stop their insurance policy and instead switch to public healthcare service. So many middle-class people that exhaust all their savings, and then eventually they have to turn to public health care services, and that adds to the pressure to the system. Now, a few years ago, we talked about $50 billion to support voluntary health insurance schemes. I fully follow what Mr. Chen Paul said. We really want to do something here, because for the middle class, they may not want to join the queue for public healthcare services because they're used to going to the private doctor, but then they may not have a choice eventually. And of course, there are certain good measures on the part of government, and we should commend that. For example, the government has been subsidizing private organizations to do colorectal cancer screening. And then for cataract surgery, dental services, mobile dental car vans, and so on. And even with mental health care services, many people suffer from depression, for example, and then Chinese medicine service too. So there should be public-private partnership for all these aspects, and we should encourage NGOs to work together with the government, and we could relieve the pressure on doctors. Now, we visited Hangzhou, as another member mentioned. They have smart medical services. For hypertension or diabetes, medication is delivered to the hands of patients in half an hour. So the government must learn from such high-tech examples, and we have to put in place a legal framework for remote medical services, because that's the global trend. So we need to plan for the future. We need to be ready for an aging population. So I speak.
Mr. Yu. President, I speak in support of Ms. Chen Hoi-yan's motion. I also support the amendment to be moved by Mr. Edward LEUNG. To ensure good primary health care, we must have good public-private partnership. We must make good use of resources in the private sector to share out the burden on our public health care sector. Elderly healthcare voucher scheme is one example. Now, how can we further improve our healthcare voucher scheme? Now, for a long time, people who we've been fighting for a long time that people who are over 60 can enjoy the $2 traffic concessionary scheme. But for healthcare voucher scheme, people are not so lucky. So can we lower the eligibility age of elderly healthcare voucher scheme to 60 so that those who are over 60 can make use of the voucher to use private services? Now, we should also encourage the use of technology in gerontology, gerontechnology. We're encouraging people to develop products to improve the quality of life of our geriatrics. Unfortunately, surveys show that many elderly persons in Hong Kong cannot afford products of gerontechnology. So perhaps we should allow our elderly persons to use the healthcare vouchers to lease or buy such products. And then in the community, many elderly persons have asked us whether they can use their healthcare vouchers to buy hearing aids or medical appliances for daycare procedures, etc. I hope the administration can consider giving our elderly a gift to address their long-time aspirations so that we can expand the scope of the application of healthcare voucher scheme. With over 19,000 elderly persons living in Guangdong province, but they can only use the services in Shenzhen, operated by the University of Hong Kong, but not in other provinces. Well, we talked about development of GBA, but there is no through train for the healthcare voucher scheme. I hope you can consider expanding the scope of application to clinics and hospitals in Macau and other places in Guangdong. And I think we can improve the current registration system of healthcare voucher scheme, we can streamline the procedures for reporting so that more organizations will accept the vouchers, and we should allow an elderly couple to share each other's voucher scheme, healthcare vouchers, so the whole system can be more flexible. We should expand the scope of application or healthcare voucher scheme that will make public-private partnership more effective. Our public healthcare sector have been overburdened for too long. We should not make it an empty slogan when it comes to public-private partnership. I think it has been a proven policy tool, and I think we should widen the scope of the scheme so as to promote public-private partnership. Healthcare vouchers can channel some of the demand for healthcare services to the private sector. There can be more effective use of resources in the public and private sectors, and then the waiting time and queues at public hospitals will shorten, and more eligible members of the public can be subsidized to seek medical services at the private sector. I'm sure this will encourage benign competition between the two sectors. I suggest that following the model of elderly healthcare voucher scheme, we should provide vouchers for those who are under 16 years old, who are still students, and in the long term, we should expand the scope. Family members living together can share their vouchers, and so we can alleviate the pressure on the public sector and we can enhance the efficiency. Members, may I remind you that according to our rules of procedure, this debate will have to end by 5:14. So after Mr. Kenneth Falk has spoken, I invite the mover to speak, and then I will continue with the remaining procedures. Thank you. Professor Sun Dong. First of all, I'd like to express my support for Ms. Chen Hoi-yan's motion and also the amendments. Indeed, we have to review our public health care policy in order to address the challenges brought about by an aging population. Now, our healthcare services compared with many advanced economies are quite well, but then our expenses on healthcare are ever rising, so is demand. And I think the system is facing greater and greater pressure. And the waiting times are too long. Take the hospital as an example. Now, the waiting time for medicine, specialty eyes, etc., is over 100 weeks. And I think this is rather disappointing. In order to address or to resolve this problem, we must enhance support, and I have the following suggestions. We should use stronger measures, and I think some of the proposals have been made by members. I'd like to stress them first. I support the proposal by Mr. Edward Leung, and that is to enhance public-private partnership. This has been supported by many members. We should have a whole range of cooperation between the two sectors. This is most useful. In terms of resource allocation, we must allow patients that can afford it to use private services. That is the most effective way to relieve the burden of the public sector. And then there should be more medical services center in the community. As said, we should do a better job in triage to lessen the burden on our public sector, and I support the proposal by Mr. CHIU, we should use technology. In the coming decade, the government should develop germ technology. There should be cooperation with the private sector so that some services can be provided in the community or even at home. And I support the amendments by many members here. We should develop Chinese medicine and include it in our public healthcare sector. We should enhance prevention of illnesses. Thank you. Mr. Benson, look, first I want to thank the motion by Ms. Chen Hoi-yan and the amendments by members. As early as in 1978, and WHO has already said the primary health care is the key to a healthy community. We should not just treat episodic diseases. We should prevent and also manage chronic illnesses. And I think traditionally we know that Chinese medicine is important for prevention. To put it simply, prevention is always better than cure. We can also reduce hospital admissions because of serious diseases. Chinese medicine can help us to alleviate the demand on mainstream public healthcare services. According to the Department of Health, in 2017, people were spending $260 million on Chinese medicine using their health care voucher schemes, and then in 4 years it grew by 2.4 times to $640 million. So you can see there is tremendous pressure for further development of Chinese medicine. It certainly has a role to play. Many practitioners in Chinese medicine have said that they would like to raise the status of Chinese medicine. For instance, chairman of the management committee of Chinese medicine, can it be filled by a Chinese medicine practitioner? Can we accept referrals for diagnostic services from Chinese medical practitioners? I think the blueprint should be for Chinese medicine to play a bigger role so that the two streams of medicine can play a complementary role. Many professionals in Chinese medicine have said that they have a severe shortage of manpower. To ensure that Chinese medicine can play a bigger role in primary health care, we should have a better registration system for Chinese medicine nurses. We should enhance the public's confidence in the services of Chinese medicine. We should also train professional nursing people in Chinese medicine. I hope our post-secondary institutions can have programs to nurture talents in this regard to support the development of Chinese medicine in primary health care. And I think this is also a new vocation for our young people. We'll have to wait until 2025 before our first Chinese medicine can be commissioned. Meanwhile, we should allow Chinese medicine practitioners to accumulate clinical experience. Last year, there's a new exchange policy so that for Shenzhen, Zhuhai, and Guangzhou, in 7 public Chinese medicine organizations, 10 Chinese medicine practitioners from Hong Kong have been hired to gain clinical experience. They can work in other countries' healthcare system, and young Chinese medicine practitioners can also practice and accumulate clinical experience in the mainland. This is another way out for our Chinese practitioners, and I think if the scheme works well, the government should discuss with the mainland to increase the quota so that they can bring back experience from the mainland, and we can also enhance the role of Chinese medicine in primary health care. Lastly, I believe there is great potential for Chinese medicine to develop in our primary health care. And I think we should also promote this to other parts of the world. Last December, there was the first summit. And on this, I hope the government can help our Chinese medicine to enhance their significance in the world. Thank you.
Professor Dennis Lam. Thank you, President. I support the original motion moved by Ms. Rebecca Chen. With no health, we have got nothing. When we are still healthy, we may think that it is something that comes by easily. It is only when we lose it that we would cherish it. We have to make an effort to have health. Many members mentioned prevention is better than cure, and we should cure the illness while it is still obscure. Well, it is quite old school. It is, in fact, quite difficult to put these proverbs into practice. If we can achieve that, we can minimize the cost of medical expense and achieve better results. Primary health care is a crucial link in our healthcare system, which is often neglected. Focusing on primary health care is a global trend, and it is something that the WHO has been promoting. On this front, we have a lot of room to improve. The funding for hospital authority has increased to $80 billion in year 2020. In the future development, part of the funding can be channeled into the development of primary health care to speed up the development. In the Chief Executive's 2017 policy address, it was suggested that DHC or DHC Express be set up in different districts. After several years, more than 10 DHC or DHC Express are up and running. This can alleviate the burden of the hospital authority. Like the Secretary for Food and Health said, the Bureau is carrying out a review on the governance structure of primary health care. This is very important. Coupled with a blueprint, which would focus on enhancing community and hospital collaboration. Well, I'm so pleased to hear these progresses. The governance structure is very important. At present, the hospital authority is both the service provider and the service manager. It plays two roles, and there is a conflict of governance. If we can achieve a community hospital collaboration comprising people from the medical healthcare sector and NGOs, then the roles of service provider and regulator would be separated. I support Mr. Wong, Dr. Wong's suggestion that we can have a primary health care bureau, thus achieving better collaboration between the hospital authority and the government and achieve better results. I also support the movements, the amendments moved by Mr. Duncan CHIU. We should adopt the technology. Smart medical healthcare is our future. There should be online consultation, cure, and better home, better health monitoring at home. The standard of our healthcare system is very important. Otherwise, people would not use our service. And there are 4 A's: availability, accessibility, affordability, and acceptability. The 4 A's involve many issues, say affordability. If the government pays for everything, then it is not sustainable. We have to make sure that there is public-private partnership to achieve quality service acceptable by everyone at a low cost. And then it would be a sustainable development. I so submit, President. Mr. Kenneth Fogg. Thank you, President. Our healthcare system is at a critical threshold. The issue has been here for many years. GOPC quotas you have to fight for a quota, and the delay would make a minor illness into a major one. For those who cannot afford private doctors, private medical services, this is a nightmare, and it's brought about a lot of social issues. The 10-year plan for primary health care must be implemented as soon as possible to come up with short, medium, and long-term solutions. In the short run, we have to improve. We have to increase the number of quotas. By collaborating with the private sector, we can alleviate the pressures of hospitals and also increase the earning of the private sector. However, it would cause a brain drain of the public sector and cause a shortage of manpower. Many amendments, and as well as the original motion, mentioned Chinese medicine. I agree. For minor illnesses, Chinese medicine is definitely very helpful. And also, we can gather clinical information and promote development of Chinese medicine and helping it go global. There are 3 universities with Chinese medicine degree courses taught by mainland experts. This is very good. In the medium and long run, as mentioned in the original motion, the government can set health indicators and implement practical measures to promote a universal health and sport program. For example, we can have sport vouchers to encourage people engage in a healthy lifestyle. They can be more healthy, so that they would not be they won't be too sick to work. The LCSD since 2009 has the Universal Sports Day program. There is a slogan: everyone should do some exercise every day. However, this is just a slogan. The results is not so good. In the year 2018, more than 18% of adults are inactive, according to WHO's definition. In year 2019, the number increased to 16.5%. That is, every 1 in 6 people are inactive, which encourage people to do exercise. And also, we have to provide support in terms of sports medicine. It is not a part of our healthcare system. According to the experts, we only have less than a score of orthopedic experts and physiotherapists focusing on this discipline. Well, sports medicine is not just needed by athletes. When people do sports, they may get injured and they need a treatment. We have to provide qualification and recognition for these practitioners, and we should also provide continuing education to them to support a universal sports program. The primary health care 10-year plan is necessary. We have to provide more resources, and we have to adopt a multi-pronged approach, including promoting universal sports to eliminate inequality. Thank you. Ms. Rebecca Chan, now you may speak on the amendments. President, I thank the 7 members for moving amendments on my original motion and the 25 members who have spoken. It is a very rich debate. Now I'm going to speak on each amendment. First, riding on Dr. David Lam's amendments, I would like to elaborate on my points. In Dr. Lam's amendments, he mentioned health indicators. He also mentioned the expansion of school dental care service to secondary school students. This will help nurture a sense of healthy lifestyle since a young age. I totally support it. Besides government steering, collaboration, we also need the participation of the public. We have to make the service accessible and convenient. However, people still have to be aware of the health situation. That's why I always say there should be universal awareness for health. The government should set health indicators to encourage people to change unhealthy lifestyle. In the long run, the health indicators can become the KPIs for and standards for our departments and schools. Schools can adjust the number of physical education lessons according to the standards. It will alleviate the pressure of the public healthcare system. In terms of wordings, Dr. Lam's amendments mention collaboration between community and hospitals as well as co-care. However, the original wordings, for example, mobile healthcare stations and influencer triage stations, these are removed. Without these, we cannot achieve immediate results. So I have reservations about the deletion. Concerning Mr. Kingsley Wong's amendments and Mr. Edward Leung's amendments about screening, I think with screening we can identify patients earlier on, and through regular checkups we can encourage people to manage their health. It will enhance people's awareness of health. In Mr. Kingsley Wong's amendments, he mentioned a number of measures. I agree. However, he deleted the wording in my motion that we should re-establish the focus, that is to shift it to a more prevention-focused approach. I have reservation about this. I would like to elaborate on this approach. In the past, we only focus on treatment. The government has admitted it, and the government promised to turn the situation around. I've heard the government promising that we should put more focus on prevention, and some people think that this would mean directing resources away from treatment. I don't think so. When we talk about the planning and allocation of resources, we have to bear in mind that we have an aging population, and we are faced with the continuous challenge of the COVID situation. The free tier of our medical healthcare system is crucial for the next 10 years. If we have this 10-year primary healthcare program, we cannot neglect resources directed to the second tier and the third tier. And also, with a better primary healthcare system, as well as a sound tier 2 and tier 3 system, there will be no missing links. We cannot achieve everything in one go, however. So I think it is more pragmatic to set up a 10-year plan for primary healthcare. Mr. Tommy Cheung mentioned increasing the pace of introducing overseas trained doctors. Well, I think because of the shortage, we have to nurture more talents locally. This is to address the root problem. However, I agree with Mr. Tommy Cheung. Ms. Judy Chan and Ms. Eunice Yong mentioned that we should incorporate Chinese medicine and also physiotherapy into the system. I agree. And also Ms. Duncan mentioned that we should make good use of INT to enhance the quality of telemedicine. I support. I also submit. Thank you, President.
Secretary for Food and Health. President, I'm grateful to all members who spoke in the debate. I'm particularly grateful to members for their invaluable comments on Mr. Hoi-yan's motion on the 10-year plan for primary health care. I also thank other members for moving amendments. As I said in the opening address, our public healthcare system is facing an immense challenge. We expect that the number of chronic patients will increase to 3 million in the next 10 years or so. So the very top priority of this term of government is to develop primary healthcare. We need to make a substantial effort in promoting prevention. This is an investment. We need to plan for the future. We need to strengthen our first lines of defense in the healthcare system. And then with a comprehensive healthcare system, then the primary healthcare could become the gatekeeper for secondary healthcare services. And then the public will be able to receive the most suitable services, and we could enhance their health and also lessen the pressure on public hospitals. Now, Mr. Chen Hoi-yan said that we need additional resources for primary healthcare, but at the same time, we're not going to overlook the importance of services in the secondary and tertiary tiers, because we are expecting an aging population and an increase in the number of chronic patients. So therefore, secondary and tertiary tiers of services are important too. The Food and Health Bureau has started reviewing the relevant plan for primary healthcare services and governance framework, so that we could develop a blueprint for sustainable development of primary healthcare services. I will respond to members' points briefly. Many mentioned the long waiting time at public hospitals, and also there's a shortage in healthcare manpower. There's need to increase manpower. On long waiting time, well, there are two main reasons for that in the hospital authority. One is because we have a large number of patients, we have an aging population, so there are many chronic patients. The second reason is because we do not yet have an effective primary healthcare system to serve as the gatekeeper for patients. That's why there are long queues at specialist outpatient clinics. So that's why we are going to develop primary healthcare services as a form of gatekeeper. And also, we want to work better with private practitioners too. On manpower, there are 2 points here. One, we don't have enough manpower. So therefore, we're going to increase the number of non-locally trained doctors, the number of training places in medical schools, and so on. And another consideration is training. Now, we need to actively promote the development of primary healthcare services, so we need to do more training in this respect. And we need to attract more healthcare personnel to join the primary healthcare sector. Mr. Tommy Cheung and others have suggested that we should make the most of healthcare professionals to lessen the workload. So in our new training programs for Chinese medicine practitioners and other allied health professionals, we have enough supply in the medium to long term. But then in the 2021 policy address, the chief executive mentioned there is need for us to strengthen the roles of other healthcare professionals. So with the relevant councils and registration boards, we will follow up on the various recommendations made in the report on the strategic review of healthcare manpower planning and so on. So we will allow direct referral services, say to physiotherapists, to avoid any delay in treatment. Now, some members suggested a third medical school. The government has been actively increasing the number of training places in the 2 medical schools in Hong Kong. In 2008 to 2009, the number of places were 550. Now we have almost doubled that. And then in the next triennium, we plan to increase further the number of training places funded by the UGC. Mr. Edward Leung suggested we should consider setting up a third medical school. Now, it takes a long time to prepare for such a school. We need to make plans, we need to recruit teaching staff and so on. So we're not able to found a school soon, and that will not address the immediate shortage of doctors. So rather, we are going to make legislative amendments so to bring in non-locally trained doctors, because that will be a better solution to address the immediate shortage of doctors. Now, many members suggested that if we want to develop primary health care, or we consider existing services, then in terms of long-term planning, service integration, and so on, there's much that needs to be done. I said in my opening address that we're going to have a primary health care development blueprint. There are 5 directions that I mentioned. And also we will review public primary health care services, especially the positioning of general outpatient clinic. And then we want to focus on services for the low-income groups and the disadvantaged. We want to provide sustainable service. Very importantly, we need to provide chronic disease management services. So in the blueprint to be published, we will be, finalizing all these plans. And then we want the private sector to take some pressure off the public sector. We are going to consider more public-private partnership schemes. We also want to bring in the concept of strategic purchasing. Just now, Dr. Wang Yunsan mentioned that. And we're also going to consider the subsidy amount and so on. We want to pick the most cost-effective services. Now, of course, if there are services provided by the private sector, and then they are more expensive than the public sector service, then we will continue to keep the public. Then we will continue to provide the service in the public sector. Professor Dennis Lam talked about governance structure. I agree, is very important. And then other members mentioned or asked whether a primary health care council will be set up, or maybe there could be someone tasked with the promotion of such work. Well, yes, that could be considered, but whether it will be called a primary healthcare council or it will be in another form, we will look into that. But we agree, if we want to promote the development of primary healthcare services and we want to evaluate improved services in a timely manner, then definitely there is need for a dedicated body to take charge. Many members mentioned elderly healthcare vouchers. Of course, we fully see your concern. We'll make sure that resources plowed into the voucher system are used optimally. We will have to consider the public finance angle. We have to make sure that the voucher scheme could actually be adjusted suitably. And then within the framework of the primary healthcare blueprint, we will regulate the use of the vouchers. For example, we may designate a certain amount of the voucher to be for specific purposes. And then we will require the registered doctors to be the family doctors of these individuals. And then even for the family doctors, the vouchers must be used for specific purposes. And then we will bring in also the concept of co-payment and so on. Hopefully then the elderly would be able to make the most of their vouchers. I'm grateful to members for all their various views and suggestions. As we review the voucher system, we'll certainly take on board all these views. Many members, including Mr. Chen Kim-paul, would like us to do more disease prevention under the voucher system. Yes, the prevention is very important. And also non-communicable disease are a main cause of poor health. That's why in 2018 we published a strategic plan on preventing non-communicable diseases. We have set 8 targets through healthy diet, work, exercising, reducing consumption of alcohol, and so on. There are various action plans to meet all these targets. Mr. Kingsley Kwok mentioned the prevention of cancer, and then Ms. Maggie Chen and Mr. Chen Hock Fong mentioned women health issues in particular, and they also suggested screening services. The government already attaches great importance to this area of work. In 2001, we set up a certain cancer committee comprising of various experts. And our colleagues, the committee, formulate plan strategies on preventing cancer and also on screening cancer and so on. So from a public health perspective, now whether the government would roll out screening programs for a particular cancer, we will first do an assessment. We'll see whether the cancer is common in Hong Kong, and then we'll see how accurate the screening is and how safe it is, and also we'll see if look at the cost effectiveness of screening and being able to reduce fatality and so on. So based on these principles, the government has already launched a cervical cancer screening program and colorectal cancer screening program, and then in September 2021 we started a 2-year pilot program for screening breast cancer. On the development of Chinese medicine, I see many members consider that very important, and they would like the government to do more in this respect. Ms. Eunice Yeung, in her amendment, proposed stepping up the development of Chinese medicine, because so it shows that members are very much concerned about the development of Chinese medicine services. Now, I mentioned the Chinese Medicine Hospital, and I would like to emphasize that this hospital is based on Chinese medicine. We also have 18 Chinese medicine clinics and research and teaching centers with also integrated Chinese Western medicine hospital services. We also have a $500 million Chinese Medicine Development Fund to support our long-term policies in developing Chinese medicine services. And then Chinese medicine will also provide services to patients who suffer from stroke or other pains, and they will provide acupressure and acupuncture services. And then at the Chinese medicine centers and these research and training centers also providing moxibustion therapy. So some members suggested we apply technology more to healthcare services. Mr. Duncan suggested that the government should make good use of technology. Now, for big data and analysis platform for healthcare services that's been set up by the hospital authority, so it will allow more interaction. The hospital authority and its team will be able to analyze data in a safe and controlled environment. And the other aspect is EHR. So far, some 4.6 million people have registered. It's about 60% of the population. The second phase will be implemented soon. That will expand the scope of the EHR system. It will also become a patient platform. We'll be upgrading the functions of EHR, and it will be expanding the scope of coverage. Now, some suggested that perhaps Chinese medicine practitioners could also have access to EHR. In fact, in this year, the first quarter, we are going to open up the EHR to Chinese medicine practitioners on within the framework of the primary healthcare health blueprint. We will also build and strengthen a database for the health of the people of Hong Kong that allows us to have access to big data, and then we could assess the health situation of the public. So with such data, we can then formulate evidence-based healthcare policies. Now, very quickly on dental services, there is strong demand for dental care. Many members mentioned that the government is fully aware of the strong demand for dental care services. We believe good oral hygiene and habits are important are an important form of prevention. So the policy of the government is to publicize and educate the public so they will take care of their oral health. And we want young children to learn from an early age about the importance of maintaining oral health and hygiene. So when children become secondary school students, they will learn, they will still know how to take care of their own oral health. Of course, for elderly, there is a program under the Community Care Fund, and also the elderly could make use of their elderly healthcare vouchers to get dental care services. Finally, President, I mentioned the health care development blueprint. I would like to thank members again for their invaluable comments. We will continue to enhance the various measures to promote primary health care so that we could take some pressure off the public sector. At the same time, we will provide the necessary resources. Within this term of the government, we're going to publish a blueprint on the sustainable development of primary healthcare services in Hong Kong. And then we're going to give our proposals on service integration, increasing manpower and training, stepping up data surveillance, also sharing of medical records and so on. We're going to offer various detailed proposals, and we will set targets too, so that we could build a primary healthcare system that will help to promote the health of the public. I hope when we publish the report, we will have the opportunity to exchange views with members on this topic. Thank you.
I now call upon Mr. Kingsley Wong to move his amendment. President, I move my amendment. I propose the question to you that Mr. Kingsley Wong's amendment be passed. I now put the question to you as stated. With those in favour, please raise their hands. Those against, please raise their hands. Mr. Gary Chan claims a division. The division bell will be rung for 5 minutes. I remind members to vote. Please press the button in front of you. Voting begins. Please check your votes. If there's no question, voting is closed. Please show the results. Election committee, there are 36 members, 28 for, 0 against, 8 abstention. Functional constituencies and geographical constituencies, 47 present, 25 for, 0 against, 21 abstain. The question is agreed by a majority of each of the 2 groups of members present. I declare the amendments passed. Ms. Dari Lee. President, I move that in the event of further divisions being claimed at this meeting in respect of the motion of 10-year plan for primary health care and the amendments, this council shall proceed forthwith to the division after the division bell has been rung for 1 minute. I put the question to you. Those for, please raise your hands. Those against, please raise your hands. I think the question is agreed by a majority of each of the 2 groups of members present. I declare the motion passed. I order that in the event of further divisions being claimed at this meeting in respect of the motion and the amendments, the council will proceed forthwith to the division after the division bell has been rung for 1 minute. Members have been informed that as Mr. Edward Leung, as Mr. Kingsley Wong's amendments has been passed, and Ms. Judy Chen and Ms. CHEUNG will not move their amendments. Mr. Edward Leung, as Mr. Kingsley Leung's amendment has been passed, you may move your further amendments. President, I move my further amendment. I propose the question to you that Mr. Edward Leung's further amendments be passed. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the 2 groups of members present. That is, I declare the amendments passed. Dr. David Lam. As the amendments of Mr. Kingsley Wong and Mr. Edward Leung have been passed, you may move your further amendment. President, thank you. I move my further amendment. I propose the question to you that Dr. David Lam's further amendments be passed. And I put the question to you as stated. With those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the 2 groups of members present. I declare the amendment passed. Mr. Tommy Cheung, as the amendments of Mr. Kingsley Wong, Mr. Edward Leung, and Dr. David Lam have been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Mr. Tommy Cheung's further amendments be passed. And I will put the question to you as stated. With those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the 2 groups of members present. I declare the amendments passed. Mr. Duncan CHIU. As the amendments of Mr. Kingsley Wong, Mr. Edward Leung, Dr. David Lam, and Mr. Tommy Cheung have been passed, you may move your further amendments. Thank you, President. I move my further amendment. I propose the question to you that Mr. Duncan CHIU's further amendments be passed. And I put the question in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the 2 groups of members present. I declare the amendments passed. Ms. Rebecca Chan, you have 58 seconds. After 2 years of pandemic, if you ask what is the most important thing in life, many people would tell you health. Aging population is picking up pace. In the past, today we are still facing the 5th wave of the pandemic. A lot of non-urgent services are suspended. There are lots of delays in treatment. It shows that the primary healthcare network is of extreme importance. I thank the frontline medical staff who have been staying in their positions despite the difficulties. This is a motion with no legislative effect. However, I hope the government will pay attention to the suggestions made by members from across the political spectrum in the past 4 hours. That is, there is a consensus that primary healthcare is very important. The government should set up a 10-year plan of primary healthcare and reduce hospitalization to make people healthier. Thank you. I now put the question to you that Ms. Rebecca Chan's motion, as amended by Mr. Kingsley Wong, Mr. Edward Leung, Dr. David Lam, Mr. Tommy Cheung, and Mr. Duncan CHIU, be passed. Ms. Rebecca Chan claims a division. The division bell will be rung for 1 minute. Voting begins. Please check your votes. If there is no question, voting is closed. Please show the results. Election Committee, 38 members present, 38 for. Functional constituencies and geographical constituencies, 47 members present, 45 for, 1 abstention. The question is agreed by a majority of each of the 2 groups of members present. I declare the motion as amended passed. Members, this is the last council meeting before the Year of the Tiger. I hope Hong Kong can remain prosperous in the Year of Tiger and overcome the pandemic, and the boundaries can be resumed as soon as possible. I hope that will be good governance and help to everyone. The council is adjourned. The council will resume at 11 a.m. On Wednesday, the 9th of February.